Okay. Just waiting for people to join. Literally, if one person joins, we start. Okay. So, in the meantime, I will be applying this my lovely daily lip colored NYX. Then we'll wait for someone to join. And if no one joins, I'll still continue. I'll still make the video. I'll show up every day. I guess that's the goal. All right, so we got 3 people. Ooh, interesting. Okay, so let's have a quick chat. Um, a video was supposed to go up today, but for some reason, I couldn't get myself to edit it. But I still felt like I wanted to come on here and have that conversation about what courses to study because you guys have asked me loads of questions. I'll probably still make an extensive video about it, but just so for the sake of consistency, we're going to have a chat about it today. And I did note some things down. So this is mainly science related, right? Like healthcare related. What should you study if you're thinking about coming to the UK for a master's degree? What are those study courses that you should consider? Now, as an immigrant, I know that a huge part of the goal is, coming to the United Kingdom, get a job that would sponsor you thereabout and um stay in the UK. So we're going to look at what are the things you should consider when you're choosing those courses and what should you be looking to explore. Now, I know a lot of people just look for fancy courses, and why I say not public health is, let me first put this disclaimer out there that public health is hugely saturated. If you go to any school right now, and look at the number of students they have for public health, the more we have loads of people, and the vacancy available for public health it's not so many compared to the number of students that we have studying that particular course. So that's something that is worth noting. So if you ask me, and as I have always said, I don't know if you've seen any of the videos, do not choose public health if the goal is for you to come into the UK and use whatever you study to get a job within the healthcare sector. So this is why I have made a list. I have five courses on this list that I have made, and for the last one that I'll be mentioning, I have a huge explanation on how it is possible for you to study that particular course without paying any fee. So you have to wait to the end. If you don't watch to the end, you would not hear what I have to say. I'm not saying it first, I'm saying it last. Well, I guess if you call it hidden tactics, yes, it is. So the first thing I have on my list is SALT. So that's speech and language therapy. You can agree with me that it looks as if right now the need for multidisciplinary team for neurodivergent people is on the rise, and um speech and language therapists are one of the multidisciplinary team who deals with speech delay, speech impediment, echolalia, and all of those bits. So the need for speech and language therapists is on the rise, and I foresee that this will keep increasing because right now, like it was said recently, a couple of days ago, that there is in the US, I don't know how valid that point is, but I'm going to use it here, which is there is an epidemic of autism, right? And the need for speech and language therapists will keep rising. So this tells you that if you choose to come into the UK and study speech and language therapist, there is a huge chance that you're going to get a job that will offer you a sponsorship, and you do not have to, you know, try to strive to be on a particular to get a COS. Now start applying for jobs that you don't even know what is required of that job. You're just applying because there is a possibility that you might get sponsorship. Do you get? So, and this is a career that I think you would absolutely enjoy. The satisfaction rate of people who work in speech and language therapy is immensely satisfying, if I can say so. I'm not a speech and language therapist, but I have had to deal with speech and language therapists, and I think they truly, you can tell when people enjoy their job. I think they truly enjoy the work they do. And the second I have on my list is occupational therapy. Again, healthcare sector, the need for occupational therapists is also out there. the NHS we know is struggling, but they still need people and they keep bringing people in. This is not a discussion about the pay, because I know some of you will come for me and be like, the pay, this, that. This conversation is not about the pay. This conversation is for immigrants who want to come into the UK and are looking for ways to stay. I hope I'm not in your screen too much. Anyway, if I am, just bear with me. So speech, I said occupational therapy, right? That's another field you could consider. People have asked me different things. You guys will message me and be like, should I study advanced da. I am not okay. Let's address this once and for all. I don't know. I don't know how many people I have to sell. I don't know. It's your choice what you choose to study. But what I want you to consider when you're choosing what to study is, what is your goal for coming into the UK? Because it's not everybody coming into the UK to study something that has the mindset that, oh, I want to come into the UK and stay in the UK. But if you want to come and stay within the UK, this list that I'm making is for you. But if you your intention is to just study and go back, by all means, please study and go back with whatever cost. No, I don't think that any knowledge is ever wasted. Now, that said, the third on my list is medical lab scientist. I mean, the need is on the rise. Medical lab, microbiologist, medical lab, whatever category that there is for medical labs, yes, you do absolutely want to jump on it, because you would have the opportunity to get a sponsored job, and then you can work within that particular field. And you can attest to it that all of these occupations that I've mentioned are quite notable, and there are roles that I believe that if you are looking to build a career out of something, you will genuinely benefit and you would love what you would be doing. Now, next on the list is clinical psychologist. Someone has asked me that, oh, it's so difficult to get into this particular field. Yes, there is no field that is not difficult to get into, but I want you to understand that if you want something, you have to give it your all. You have to go for it. So if you keep telling me it's this field is difficult to get into, that just tells me that you haven't nailed all of the requirements that has been asked of you. And how well to do that, then message the school, email the school. All these things are easy to get. Go online, look for the lecturers, the leads that you have within particular department of whatever university you want to attend. Have a conversation with them. Please, can I jump on a quick call with you? I just want to, pick your brains. This is who I am, this is what I do, and I'm looking to sign up to a program for a master's in clinical psychology. Are you willing to talk me through? Nobody is out there, at least of what I know, nobody is sitting in their office and saying, you know what, I'm going to fail all these students, I'm going to not allow the student come in to study. How does that favor them? But the only reason why you'll be rejected is if they think that you do not have the requirement to come onto the role or to come onto the course, right? So clinical psychologist is one of those, really, it might be quite difficult to get into. So you need a strategy to do that, and that's the strategy I just told you. And last on my list, I mean, you probably already have an idea and you're probably wondering, you've not mentioned this. It's nursing. Now, I have a bonus tip after this as well, which is another occupation, but not in healthcare, but it's in social care sector. So nurses, we have a shortage. It's like an epidemic of an epidemic of a shortage of nurses in the UK in the NHS sector. So you would always, oh, I'm twisting. I was wondering why I was twisting around. So you would always need nurses, and nurses are highly needed at the moment. So you want to go in for nursing. I have supported several people in the last couple of weeks to secure what's it called now, admission to study the pre-registration nursing, the MSc one, the BSc one. I've supported quite a number of people in the past couple of days, and they have secured those roles. So they have secured the courses. Some of them got their feedback in like 2 weeks, some less than 2 weeks. They got signed on. Did some of them had to do interviews, and they did those interviews, and nailed it, absolutely nailed it. And a number of them are coming into the UK to begin their courses, and well, congratulations to them. So that's one field I know that the number of nurses that are needed, it's there's always a shortage. There is always a shortage. Now, what's the bonus bit that I was going to say is, say for example, you've been in the UK and you studied a random course and you want to switch on to nursing. It is possible for you to sign on to nursing, to become a nurse, without having to pay anything. And that's only possible through the Welsh government initiative. You know that in Wales, you can be sponsored to study MSc nursing, which is a 2-year pre-registration route to become a nurse, whether mental health nurse, adult nursing, learning disability, child nursing, anyone, you can be sponsored. But the only caveat to that is you have to work in Wales for the next 2 years. And I think that's fair enough. But they will pay for your nursing degree, which means that no student finance, no student loan will be taken. It's totally and 100% paid for. So that's something you might want to explore. Or if not, you can choose to leave and pay back the money. Do you understand? But it is possible for you to study that nursing, particularly if you have been in the UK and you studied another course, maybe another MSc, you've done another MSc, and you want to move on to the 2-year pre-registration route MSc, then absolutely. We have the BSc as well, which is pre-registration. Say for example, you've studied another course before, maybe you've done a first degree in another sector, say accounting for example, and you want to move to health sector, you want to do nursing. Yes, you can also do that, and the Welsh government will be willing to pay for that through Health Education and Improvement Wales and the NHS bursary. It's a whole thing. If you Google that, or I can, after this video, when I upload it, maybe later in the evening, put the link in the description box so you can go check it out and see all of the processes involved. So I do hope you get that. Now, the last point, which is like a really good giveaway that I am giving you guys today, just because I am trying to supplement for the fact that I did not upload anything, is another bit to consider, which is not a healthcare job, is a social care job, which is social work. Yes, before you turn your nose away, the social work is not just for you collecting people's children, which is what most of you think. No, so it's social work, and you do not have to go back and study social work for 3 years like you would think. You don't necessarily have to do that. You could do a master's, just like nursing, which is 2 years pre-registration. You have a 2 years pre-registration for social work as well, and you'll be signed on to the social work register, so you can explore that. That is something worth exploring. And for this particular one, the bonus to it is, it's not only if you have a degree that you can come on. So if you have valuable experience, say for example, you've been in healthcare, say you've been working as a support worker and you have your MVQs and you've worked quite a number of years. I don't know the limit, but you've worked quite a number of years, but you don't have a degree. You can be signed off on to this MSc, MA, is it MA social work? Yeah, MA social work. You can be signed on to it. So one school that I know that does that, because I'm in Wales, I'm quite partial. I love Wales. I am very biased when it comes to Wales. Yeah. So I know that if you check out Cardiff University, they offer this particular thing I'm talking about, which is if you have experience that is valuable and we can demonstrate it and you can back it up with evidence, absolutely. So how are you able to judge whether your experience is valuable? Again, these emails that lecturers have is public knowledge. They have it out there so that you can reach them. So reach out, explain who you are. And if you don't know how to, I'm here. I can support you. You know that. I'll leave all of the details in the description box. So I hope that I've chatted enough. I've given you guys will I say a bonus for not giving you guys a video today. So yes, now that that's done, if you have any questions, you can email me. The email um the email address will be in the description box. So reach out if needs be. All right. Until I see you guys again, make sure you put a smile on somebody's face. And I'm about to drive off now. I'm about to drive off. Why do I keep rushing? I'm about to drive off. All right, guys. Bye. Thank you for watching. I had quite a number of people. Impressive. Thank you. And I hope to come on live more. More. You see my face more. You guys will be tired of my face. Bye, guys. Let me sit well. Mhm. Okay.